Good afternoon. This is Ron Klein. I'm chairman of the Jewish Democratic Council of America, and we welcome you to this afternoon's conference. In the 2 years plus since our founding, JDCA has established itself as the voice of Jewish Democrats, advocating for Jewish and democratic values and supporting candidates and elected officials who share the values in order to bring about political change. This is exactly what we did in the 2018 election when we endorsed 58 candidates across the country and 84% of them won, helping to flip the House from red to blue. It's what we will do in 2020 when we work with the Senate and help flip the Senate and the White House with overwhelming support for Democrats among Jewish voters. To that end, JDCA has already endorsed 45 House and Senate candidates running in 2020 in key races and will announce additional endorsements shortly. We know that Jewish voters will continue to support Democrats because only the Democratic Party shares our views on issues of importance to our communities, such as ensuring voting rights, combating the rise of hatred, anti-Semitism, and bigotry, and ensuring access to affordable health care, something that is very evident at this very moment. Of course, many of these issues have become even more important and relevant as we navigate the current coronavirus pandemic, and it has become painfully clear that the Trump administration handled this crisis so poorly. We realize that the coronavirus is impacting every aspect of our lives, and JDCA is here for you as a resource and source of information during these uncertain times. That is why we're hosting this Democrats Leading in Crisis call series to highlight Democratic leadership and expertise at this unprecedented time, and we are glad that hundreds of you have joined us for these calls over the last couple of weeks. Before we go further, I do want to mention that you can get more information about us at jewishdems.org. That's jewishdems.org. It has our platform. It has how you can get involved in various state and local activities, how you can support us financially, and most importantly, what you can do to help change the outcome of the future upcoming election. Today, we're going to look at the impact of COVID-19 on education and our nation's teachers, as well as healthcare workers, and we couldn't have better speakers to address these critical issues. We're very excited to have them. I'm now going to turn it over to our JDCA board member, Marcy Orley in Michigan, to introduce our speakers. Marcy?
Thank you, Ron. We are grateful to have Randi Weingarten and Anne Goldman joining us for today's call on education in light of COVID-19 and the situation facing teachers and healthcare workers amid this crisis. Randi Weingarten is president of the American Federation of Teachers, AFL-CIO, which represents 1.7 million teachers, as well as nurses and other healthcare professionals across the country. Prior to her election as AFT president in 2008, Randi served for 12 years as president of the United Federation of Teachers, AFT Local 2, representing approximately 200,000 educators in New York City, as well as home child care providers and other workers in health, law, and education. In 2013, the New York Observer named Randi one of the most influential New Yorkers of the past 25 years, and Washington Life magazine included Randi on its 2013 Power 100 list of influential leaders. There is no doubt she's a powerhouse in the democratic world, as well as the Jewish community. On a personal note, I met Randi at Cardozo Law School and have followed her amazing career for so many years. We are so lucky to hear from her today. On our call, we will also hear from Anne Goldman, Vice President of United Federation of Teachers, representing the more than 45,000 UFT members in New York City. A registered professional nurse who has practiced in a variety of specialties, Anne was an early leader in the movement to win collective bargaining rights for nurses in New York City. Today, she's representing the healthcare workers on the front lines of the new ground zero of the COVID-19 crisis in New York City. Before turning it over to Randi and Anne, I also want to ask that you send your questions to info@jewishdems.org, and we will take as many questions as we can. Thank you for joining us, Randi. Over to you.
Thank you. Can you hear me? Can you, am I being heard or no?
Yes, we can see and hear you.
Oh, great. Okay.
Sorry. That sounds like my dog, so. So I am really honored to be with all of you, and I'm glad that Anne is going to be with me. And
I'm not sure Randy is on the call yet, but I'm sure she'll be on very soon.
no, I am on. Can you hear me or no?
Yes, we hear you and we see you.
Okay, great. Sorry, I don't know if Anne is on yet. But so let me just say that this is an experience, at least in my lifetime, like no other. And it is, we represent, so let me just kind of sort of dive in. We represent about 1.7 million people. It's been interesting in the last few days how many members are like calling locals and saying, I just want to make sure that you have my information. I want to make sure that I get the information from you. There is a sense of fear and dread and needing to come together in some ways like no other. And I don't know where everyone on this phone is, but I happen to live in New York. I work in Washington. I live in New York. And the last hour has been the first time, I would say, in the last 3 or 4 days that it's been an hour without an ambulance going by. It is a time that has completely unended a lot of our life. Hey, Anne, I'm glad you're here. A lot of our life as we know it, because of the transmission, how the disease gets, or the virus gets transmitted. And as a result, it's also a period of time that has very much ended or very much sliced down our economic life, which will have very long-term effects unless we have a real kind of stimulus in a Keynesian way, I believe, that is more Rooseveltian than Hooverville, and that is more stimulative in terms of the economy as soon as actually people can be able to healthily get out of this process, get out of, the pandemic that we are in right now. But that's, those are probably for other questions. What we have been doing and let me just say, I held my first press conference on the effects of coronavirus on February 2nd of this year. And if I actually understood just from the outside world, just from our epidemiologists, just like our nurses, like Anne Goldman, who's going to speak after me, just like if I understood what was going on in China and South Korea, I don't really understand why our federal government did not do what they needed to do, or that I have seen every federal government attempt to do, Republican and Democratic, in the last 20 years in terms of a national response. And I think that the ham-handed way in which they have handled it, Trump in particular, because his electoral needs and his own narcissism was more fundamental to him than the health and safety of people, I think we're going to have a longer time in this pandemic than we should have had. I think we should have been much more like South Korea and much less like Italy. And it appears like we will be much more like Italy and much less like South Korea. And so the 3 things that we have done as a union since the beginning of February was, number 1, focus on the health, safety, and well-being of the community as a whole. We represent people in 3,500 locals. And so we basically represent urban, suburban, and rural communities all across America. And so the first issue was just the general health and safety and well-being of people. But second, we have focused like a laser, and I'll get back to the first in a second. We focus like a laser on the health and safety of our healthcare personnel. We represent almost 200,000 people who work in hospitals, nursing homes, home care every single day. People like Anne's members who are at Lutheran Hospital in Brooklyn and Staten Island Medical Center in Staten Island, in Ohio, in Montana, in downstate New York, Stony Brook, New York, Oregon, Washington State, Connecticut. And so I actually, my nightmare every single day is how the heck do we get PPE to folks? Not simply how do we make it a big issue. I think that we and nurses and doctors all across America have done that. The problem is that the delivery system is so screwed up that governors are competing against each other, that we do not have enough personal protective equipment, not just enough ventilators, not just enough beds, but we don't have enough personal protective equipment to safeguard the first responders and the healthcare workers who are the soldiers in this war. And so the second piece that we have focused on is not just screaming about this, not just advocating about this, but I've actually done something I never do. I'm trying to source it from freaking China. And this is the kind of stuff I'm on the phone half the day trying to figure out if we can get PPE and paying from our dues monies for PPE for our members, and trying to hope against hope that they can get here from China in time to make sure that we can save our members' lives who are trying to save others. And the third issue that we are focused on, I'll get back to the first in a second, but the third is obviously the long-term and the short-term impacts of what's happened when the economy has essentially had to be closed down because we didn't act like South Korea. We are acting, we don't have enough testing. We don't have, I should say, we'd probably be in this kind of lock in place process anyway for a month or two. But the question is, are we going to be here for 6 months or no? And what happens in terms of the short and the long-term prospects for people when 40% of Americans before this crisis could not put $400 together in an emergency, when 40% of Americans had no retirement income, so they don't even care what Wall Street does or doesn't do because they don't even, they don't have anything in their 401ks. And so this whole notion of what do we do long-term and short-term, and I think what, and I don't have to kind of go through what COVID 1, 2, and 3, where you saw it, everybody saw it. But what Pelosi and Schumer tried to do in both COVID 2 and COVID 3 was to actually try to use the safety net as warped as it is right now and as weak as it is right now, to kind of increase SNAP, to increase unemployment, to create some state and local funds so that state and local governments have liquidity, to try to create some funds for schools, K-12 as well as higher ed, so that we could actually do the stuff that we're trying to do. And the most important thing they did probably was, other than state and local and the hospital work, was probably the work they did to have unemployment on steroids. Because as you see the numbers today, in the last 2 weeks, we've had over 9 million people go on unemployment. That is, by comparison speaking, there were, throughout the entire 2007-8 recession, it was 7 to 8 million. And today it's 9 million in 2 weeks. So trying to make sure that people have money in their pocket so that they don't get evicted, so that they can feed their families, so they don't default on mortgages, they don't default on student loans. And if there's ever an argument for, frankly, the kind of Rooseveltian New Deal, changing the rules, figuring out how to make government work in a pandemic that is both a health emergency and an economic emergency, and how there's a huge difference between what the Republican Party and the Democratic Party would do economically. This is a moment of that shows that clearly. All of the inequities are exacerbated right now. And that gets me back to kind of the health and safety and welfare of what we tried to do as teachers. So the pandemic, as I said before, we started on February 2nd. We basically said, this is coming to the United States. We need to prepare. I can kind of resurrect what Sarah Nelson and I did that day. But we tried as a union to get people information about what was going on, not just wash your hands, not just don't touch your face, not just don't go to work if you're sick, but long-term what this would mean and what we needed to do. What we didn't know was we had no idea that it would spread this quickly and that we would have no testing or no other equipment to try to isolate where it was spreading. And so the day that the pandemic was declared by the WHO, which was like March, I think 14th, 13th or 12th, we started working with schools and school systems across America to close. And I want to give props to New Mexico. The current governor there, Michelle Lujan Grisham, was a former health commissioner of New Mexico. So she, more than others, understood that with the spread of the virus, if you didn't close schools, you would be spreading the virus. And so we had 5 or 6 days in New Mexico to do things like figure out what to do for the 30 million kids that get fed every day in school, figure out what to do for having childcare for healthcare providers, figure out what to do for vulnerable kids, and then figure out what the heck to do when you basically move in a nanosecond from brick and mortar school to remote education when most of us, have no idea how to do that. And so teachers all across America are doing the best they can in trying to figure out how to move from, their classrooms to remote. Some of it is hard. Some of it is hard just because it's hard, because it's a skill and a task, but most of us never have done more than just, incidentally. And it's also hard because there's a lot of kids in America that don't have internet, that don't have the access to have Zoom. So we have a whole bunch of other issues that we need to do for the kids that don't have access to, because of the digital divide. But now what we're trying to figure out is not simply what to do on a day-to-day basis, but what happens if this is a month or two? What happens if it's the end of the year? And so we have a bunch of resources for people. We have Share My Lesson, which is for free for parents, for teachers, for anybody who wants to go on. We have bilingual resources and something called Coloring Colorado. But what we also proposed is, assuming that this is going to last a semester or even the end of the year, let's actually try to trust teachers and have teachers come up with summative projects for the end of the year. Like things, I keep teasing that I went to school during the Ice Age or during the, when dinosaurs ran, and, I had term projects. What if we try to figure out age-appropriate capstone projects to cap the year, term projects, that we figure out now how we help graduating seniors graduate with things like that. And teachers will be able to do this with their kids if we give them the time and the latitude to do these kind of things. Last two, it's been amazing to watch teachers. It's been amazing to watch healthcare workers. As I kind of introduce Anne, I'm going to end with these stories. The teachers in Washington, D.C., there are so many kids that don't have computers, believe it or not, or have internet. And so they worked with Fox, not just with public TV. They worked with Fox, and that every morning there at 10 o'clock in the morning, there is a teacher from Washington giving a lesson on, sometimes it's elementary, every day it's different. Sometimes it's junior high, sometimes it's high school, a lesson that is projected on TV all across Washington, D.C. The same is happening in California. If you go to Twitter or to Instagram or to Facebook, you will see thousands of amazing lessons that you see from New York City teachers, and and they just put it on and they show other people what they're doing. On Share My Lesson last week, we had 60,000 people over a 3-day period of time trying to figure out and learn different things from each other. In Rhode Island, one of our locals, Wes Warwick, spent 3 days doing 90 hours of professional development to help teachers all across Rhode Island learn how to transition from in-person to remote. And in fact, one of the districts in Rhode Island, one of the career tech ed schools, the kids took home 3D printers from the school, and they are actually making shields for healthcare providers in Rhode Island so that they can have PPE, that kind of PPE. So this is the kind of stuff we are seeing all across America in big and small ways, the kind of full-hearted response of Americans to actually help in this crisis. But the front line is our nurses and are our nurses and are our doctors. And there's no nurse better than to describe this than my dear friend and colleague, Anne Goldman, who I have known probably for more years than she or I ever want to talk about. But this is, you'll see the work that our nurses do every single day in saving lives. And they are the heroes and the heroines in this war that we are in right now. And with that, let me introduce Anne Goldman. Anne.
Thank you so much, Randi. I am honored to share the conversation, as painful and challenging as it is. And thank you. You see, Randi's leadership, her vision, her energy is what we all get inspired and feel there'll be a better tomorrow because of her logic and the systemic way she addresses problems. We believe we will have the opportunity to succeed. There is a war against an insidious enemy that in fact has been threatening in so very many ways. The miraculous part of the enemy has yet to be seen, but it will be defeated. That said, because of Randi's logic, her strength, her leadership as a union, we know we will continue to get the protection and support we so desperately need. It is miraculous to us to see our communities have the opportunity to implement remote learning, to imagine that each family will be touched, inspired, and led by our teachers gives us a sense of normal. Each day when we face the workforce faces the enemy alone, leaving behind families, leaving behind hugs and kisses that can't happen. The one thing we do believe is that we will matter to each person we see. We are all there is for so many. As I'm sure you know, there are no visitors. There are no individuals to advocate for the people we care for. So we must be the inspiration. And for us to proceed, yes, we must be safe. And because, as you've heard and can't hear enough, our union, our president, Randi, has advocated and helped each of us in our hospitals, in our work settings, have the equipment we need. How very pathetic that we have to have this discussion. How sad in today's world we have to be humbled and try to compete with each other to get basic needs, but nonetheless, that is our reality. What we do believe is that each time we go forward, we intend to succeed, but it's been slow in getting those victories. Each person that is on the line in the acute care setting needs to know you are there, needs to know society is there, And we know that because of our union. This is really a challenge that is unimaginable. It stretches families, it stretches our health. Yes, we're getting sick. Yes, we are succumbing to illness. And yes, that makes us sad. But what we do believe is that we have to have a strategic plan. We have to have equipment. We have to have staff. And people have to listen through a public service model to stay home, to abide by rules. But as Randi has said in her introductory remarks, we have an economy, a society, and people that we have to advocate for. Yes, we're vulnerable. We hurt. People do hurt at this time. But because we have leadership like Randi, and we have her energy, her vision, and commitment, we know we'll fumble, but we know we will succeed. So that's a little bit of the dynamic of the fierce challenges each day the workforce faces. We're grateful for meals that our union and others are providing. Thank you. That is ingenious because that's the humanity. We're grateful, again, that school proceeds because that makes us know there will be a better tomorrow. We're very grateful for the equipment as it comes in, and we're grateful for the advocacy so that we understand we are the front line. If we don't succeed, no one succeeds. So we do need those protections, and gratefully we celebrate the strength of our union. Without that, we wouldn't be protected. We would just be additional casualties in this horrific war. So thank you so much, Randi. Keep helping us, keep inspiring us, and we're a part of a team that intends to win.
I mean, you can all see, all of you who are on, Ron and Haley and others, why every single day we are trying to get the kind of equipment that nurses and doctors and orderlies and respiratory therapists need. You cannot imagine what those hospitals look like right now, and what people need. And I'm sure that we've all been touched by people who have COVID, but when somebody's lungs collapse and the only thing that will help them is a respirator or ventilator, and there are none, you can see why people like Governor Cuomo is so agitated, and why, because we're seeing this all throughout because of this insidious virus. Thankfully, most people will survive, and hopefully there will be an antibody, and hopefully there will be a vaccine. But I can't, and then I'm just going to open it up. Obviously, Haley's going to open it up for questions, but I can't, it is at this moment of time, as we get to Passover and we get to a holiday where we are talking about the 10 plagues that have happened before our escape from Egypt. We are in the midst of another plague, and if you want to help us in any kind of way, we do have a petition on Move On about healthcare workers need protective equipment now. The petition is on aft.org. Over 150,000 people have signed it. We are trying to get to 200,000 so we can shame the administration to increase production and release the stockpile. And we are trying to do, as I said before, many other things. But I can't thank Anne enough, and all of our members. I love that a couple of days ago, there several people from, I think, Lutheran, actually several nurses actually did signs that said to the public, stay home, stay well, stay home. And this kind of anything we can all do to kind of lift up their spirits and to create some humor, I'm sure would be helpful.
Thank you so much, Randi and Anne, for that really very raw and honest and candid, heart-wrenching in some ways, depiction of what is happening there. on the front lines in New York. And you had mentioned that each person on the front lines in the acute care setting needs to know that we are there for them as Americans. What can we be doing? And there are almost 100 people on this call now, Jewish Democrats throughout the country. What can we be doing to ensure that they know we are there for them, that we are supportive, and that we want to do everything we can to ensure they have the protective equipment they need to continue to do their work safely?
I think you follow Randy's lead on petitions. You continue with public service announcements in the respective communities, honoring the fact that staying home is the #1 tool we have at this time, and remembering those families are hurting terribly. So within particular communities, if you identify and do know of the families of healthcare workers, it means a lot to know there is an outlook for them. There are people who can say hi to them and perhaps support them with errands and other types of actions, which are daily activities. Each of those things is precious and considered amazing. We're not used to being helped. We're usually the ones giving help. But when your own family is hurting, to know someone might help with groceries, someone might help and say, if you have an elderly parent or someone who needs help, I'll call them. The communication is the human tool, and we can communicate without being together. So identifying within those communities, those families, and saying hi through virtual communication, digital communication is so welcome. Thank you.
And Randy, you had mentioned the petition that the AFT has online with Move On. Do you want to speak a little bit more about that? And of course, we
Sure.
can to amplify it as well. And I would just encourage everyone to send their questions to info@Jewish Dems. We are collecting them and we'll continue to ask.
Sure. So the petition it's a Move On petition that we have done. The easiest way to find it now, I'll put it on the top of my Twitter in the next couple of hours as well, but the easiest way is just to it's on our front page now at aft.org. And it's a petition we are doing with Move On that's entitled Healthcare Workers Need Protective Equipment Now. We have done a bunch of other things, including the heads of SEIU asked me, NEA and myself, wrote to the Chamber of Commerce because we understood it was we understood it was the chamber that was leaning on Trump not to really utilize the Defense Production Act. Frankly, an act that has been utilized a lot even during the Trump administration, but this evidently has become a cultural and an economic issue, or ideological issue as opposed to health issues. So he still has not used it in the way in which he should. Even though I hate saying this, I do think that the supply chain should be federalized so that states are not competing against each other. That is another thing that several Democrats, including Chris Murphy, have suggested. Senator Schumer suggested yesterday that there be a real czar of all of this, just like Bill de Blasio just, appointed Jimmy O'Neill, to be the czar in terms of New York. And there are several of us now, as I said at the beginning of the call, who are trying to source these kind of materials from China and elsewhere. It's not normally what I do, but what we've done is we've moved $1 million already to do that for masks, and we're about to move another $1 million. And so we're going to try to start working with we're going to try to kind of raise money, and the more money we raise, the more things we will buy in terms of this supply chain that we have now come up with. And that is, and that if you're interested in that, it's going to end up being not for, a donation to a charity. We have charitable donations through the AFT Education Fund, and we're going to use that to try to raise money to just get the supplies, because, you know, it's clear, you could see whether you're on CNN or, you know, or MSNBC or any channel, even in, you know, Fox I was on today, and people were very sympathetic, but the federal government does not know how to actually get this material here. And that probably will become Trump's biggest failure, that they were not ready for this in any real way. I don't understand how we do not have stockpiles of protective equipment, which is absolutely vital, you know, in any kind of emergency. But those are the kind of things, Haley, that if people want to help, they can do right now.
Mark from Wilmington has asked, how can we possibly make sense of the fact that 51% of people in a recent survey said that President Trump is doing a good job of managing the coronavirus situation? Do teachers, school personnel, and healthcare workers in your union, and you're the second largest union in the United States, do they share this view?
Also ask Anne to continue. First off, no, they don't share this view, but, you know, but there's a, but, you know, what you have, I mean, it was interesting in the last couple of days, Mike Fonseca, who is a New York legend, who has been a big Trump advocate and supporter, basically screamed at Trump after Trump had the Pillow Man and a couple of other CEOs there, basically to tell him, deal with the crisis you have and do your job, man. And that's the kind of stuff you're starting to see in places that really have, you know, like New York, that's a ground zero of the pandemic. But the dilemma is that we have had two things. Number one, every time there's an emergency, Americans will kind of, you know, salute to the chief and say and wish and pray that the president will do a good job. And we saw that, you know, in, you know, after 9/11, George W. Bush's ratings went up 20 points. We've seen that in other crises, you know, so there is a sense of solidarity with the commander in chief when you have a crisis. And I think that's what you saw in some of those numbers. But what you also have, and all of you have seen this, we have a deeply polarized country where one of the things that Trump did very effectively was to undermine fact and undermine science. And trust with a leader is more important than science and fact. Now, we have seen other autocrats do that in the past and in history, but the difference is in today's America, there's Sinclair and Fox that end up becoming the cacophony for that. So when Trump was saying that this is a hoax or this was not real, you heard Sean Hannity saying that. Give some props to Tucker Carlson, who at least understood it was real and drove down to Mar-a-Lago to try to convince Trump to do something different. And I also give a lot of props to Dr. Fauci and Dr. Birx from behind the scenes, because they finally got him to see it's real. But I think that when you look at, you listen to the healthcare providers, they're just going through hell right now. So they're not thinking about politics. And let Anne finish, you know, give her perspective too.
Yeah, let's be clear. One of our concerns is public panic. So one of the things we're doing is disciplining ourselves, because we don't want our communities to lose sight of being rational. And that's what happens when they see the system go down. When you see doctors and nurses crying every day as we go in to care for people, you lose hope. And we do not want our communities to panic. That should not be confused with a lack of support for people who put us in this position. We couldn't be more energized, angry, furious, but my energy has to go to solutions. My energy has to go to motivating my colleagues. My energy has to help my colleague whose spouse is on a respirator, or the doctor who is dying down the hall. I don't have time for that fight at this point. And again, let's not be confused. Randi said it in her remarks. We don't want the public to panic. I know as a nurse, when you see fear in my eyes, when I approach you, you will be frightened. And you have every reason to, because I'm all you have. So we discipline ourselves very carefully in a military type fashion to be somber and sober during this very harrowing time. But that should not be confused with thinking for one moment it's right to go to a stockpile with crap that's expired and dysfunctional, like the masks we were promised, or begging and competing. Can you imagine? We're competing with each other for respirators and equipment. We're fighting over having proper scrubs so we can take care of patients and not become sick. It's disgusting. But if we indulge ourselves in that emotion, in that sadness, it's very hard to function as we have to for hours and hours and hours. So we will not forget those challenges, but we don't wear them on our sleeves as we try and identify the main enemy, which is the virus for the moment.
Thank you. We've talked a lot about the federal government response. Oliver from DC has asked what local and state officials can be doing to support our healthcare workers and teachers at this time.
So there's a lot of, there's been a lot of governors and a lot of mayors who have been really terrific in this crisis. You know, I've had my fights with Andrew Cuomo, but he has been exceptional in this crisis. I think the governor of Washington, Jay Inslee, the mayor of Seattle, Jenny Durkin, really, they've been phenomenal because they saw what was going on and they were very clear, you know, and Anne would tell you, I've learned a lot about healthcare from Anne, obviously, but in a public health epidemic, you have to be clear, you have to be honest, you have to try to be calm so that you don't panic people. And one of the reasons, for example, that Andrew Cuomo wanted people to actually work through their spring breaks was to keep kids off the streets in New York and to keep them engaged. So teachers are actually being very, taking a real role here to actually give up their spring break to ensure that kids are engaged and not on the streets, because we need to actually keep this social distancing. Gretchen Whitmer has been terrific. DeWine has been terrific. Hogan has been terrific. So there's, and Hogan is the, you know, the head of the National Governors Association, and he has convened almost every day a governor's meeting, which is part of the reason why we know that everybody's competing against each other and they are ripshit mad, because why are they, you know, as economies, local and state economies are collapsing across the country, the one thing they shouldn't be doing is spending, you know, $4 a mask, an N95 mask. They should actually be getting it for free from FEMA, as many as we can get, you know. So I would say that there's a lot of governors that I would give really high marks to. On the other hand, Ron DeSantis has been incredibly, well, let me not use a curse word. How the heck do you keep beaches open when you know what's going on? How do you do that? And then blame New York or blame another place? The governor in Georgia, how do you say today, oh, I didn't realize that we didn't know how the spread happens, and that's a game changer, so I will have a stay-at-home order. So unfortunately, because of the disrespect of science, because of the sense that this would magically go away, or if you were God-fearing or evangelical, you wouldn't get this virus, that what we're seeing, unfortunately, is there's going to be a lot of illness in places that didn't actually follow the science and respect the social distancing.
Randy, you mentioned that all of the inequities are exacerbated right now. How is this evident when it comes to education and healthcare, and especially our teachers and our healthcare workers on the front lines? And Susie from New York has asked specifically about this. What is our strategy to help those without computers, especially if children can't go back to school until the fall? Is there a philanthropy we can support that will provide children with these computers, or are there other plans?
So, you know, there are some philanthropies that are, so number one, I think the New York Times is actually putting a list together today of some philanthropies that are going to be helpful in this regard. There is one that, you know, that we work with a lot called First Book, that is actually trying to get books to kids to read. And we're in the middle of trying to do something with them with homeless shelters in New York, which if we get it out, it will be done next week. But First Book is a philanthropy that if, you know, to get books to kids that don't have. I think that there are, we are working with several philanthropies in the ed tech arena that are trying to think about how they get computers to people. The Schott Foundation is one of them. Even the Walton Foundation, who I normally spar with a lot, is another one. I know, you know, it's kind of shocking in this moment. We've talked to Bloomberg a lot about getting computers to kids. The dilemma is you also have to get hotspots to kids too, because there's a lot of places in rural America in particular, but even in New York, if a parent doesn't have internet, you need a hotspot as well as a computer. The key is we're going to actually have to also help figure out remote learning right now for those who don't have computers. And so part of what we're going to need people to do is that next year, when there's the whole issue about whether we, you know, support our schools, and we don't get, if we don't get the money from the federal government, we're going to need a lot of support for these public institutions. It is the public institutions, the public hospitals, the public money in terms of Medicaid and Medicare that go to hospitals. It is the public institution of public education. All of these things have become the anchoring institutions for actually making this work. So the Times will have, I think it was today or tomorrow, a list of like 4 charities that they have vetted that are helping kids, helping food banks, you know, and but then there's long-term what I'm suggesting.
Great. Randy, you actually have an op-ed today at CNN.com with Dr. Jill Biden about how to, for parents like myself and so many others, how to homeschool in addition to obviously working full-time at home. So the question is, you know, for those who haven't seen it, to just summarize, perhaps you can give us all guidance. I mean, I would say it certainly has deepened, I think, the nation's appreciation for the very hard work of our teachers. Yeah. But as we all grapple with this, could you please provide some guidance to us parents? And Guild in LA is asking also for advice to share with young people who are trying to adapt to being homeschooled, as well as seniors in particular who are wondering if they'll ever go to college in the fall.
Okay, so now let me put on mom and school teacher hat for a minute, okay? And I think what Anne was saying before about us trying to make sure we create some calmness. So number one, this is a terrible infection. This is a terrible disease. Most people will survive, overwhelmingly. The morbidity, one life is one life too many to lose, but the morbidity rate is hopefully going to be 0.05% if we do everything right. The morbidity rate right now is a little bit more than that. That's the assumption that Trump and others finally got to. But we're trying, because of all the work that Anne and her colleagues are doing, trying to keep it as low as possible, even before a vaccine, even before other things. I think that's important to say, that we will get out of this. We will get out of the health crisis, and that we will also get out of the economic crisis, because we are the United States of America. And that in the physical distancing, we have to create some kind of concentric circles of engagement and trust and caring and concern that get bigger and bigger and bigger. And one of the ways we're doing this is through education. So number one, go to Share My Lesson. It is free for all parents, all teachers. We have lots of ideas about how to do home learning, because it's not really homeschooling, it's home learning. Number two, we've gone through 7 to 8 months of this year. Kids have gotten a lot from schooling this year already. And part of what we have to do is we have to figure out how to work with parents and work with our kids to sum up the year, and to actually try and hope that we can start either from the summer or next school year in as good a place as possible. So some of the things that we're suggesting is that we don't go from classroom to home, pretending home is classroom, but we do a different kind of instruction. We do silent sustained reading. We try to do debates online. We try to actually do what anybody who is my age or older knows, term projects, or capping the year with capstone projects in an age-appropriate way, so that we kind of sum up the kind of things that we have tried to teach all year. And I trust teachers to start working with kids and parents to do that. Could you imagine an art student who actually used a poster board and some colored pencils and became the next Picasso? Or could you imagine a music student who just started writing great music and, with an instrument? So we're trying to actually start encouraging people to think about the rest of the year as, how do we sum it up and use the skills that we have, and then ultimately try to figure out how we start next year in a big, bold way. In terms of colleges, some of us are very focused on how we help seniors graduate. Yes, I know it's really hard to lose the prom, but I don't know about any of you. We've been doing in my family Zoom dinners with family. We've been trying, I have friends that have done Zoom dance parties. And so we're trying to figure out how to be connected in a way that still is distant, but connected through these different kinds of ways.
Great. For our last question, I'd like to ask you both, because you have provided so much insight and color to this very painful moment. What gives you hope as you look to the future? Specifically as in terms of our Jewish values. I mean, Randi, you mentioned that Passover is coming, whether we like it or not, it'll be here next week. And we're all adapting to figuring out how we're going to go forward. What can we be hopeful for as we look ahead?
Let me
I want Anne to answer that first.
Sure. So I would just say, what inspires me is kindness, is community, is leadership. That's all contagious too. And I believe that we can be the carriers of the message of humanity. I think if there is a blessing, it is that we stop now from the arrogance of humanity and reflect on what matters and how we succeed as people together. And again, initiate the kindness, the love, and the reflection on what we should be, communities that bow our heads together and are grateful.
So it's people like Anne who give me hope. It's when I talk to the nurses and the doctors and the hospitalists and the respiratory therapists and the aides and the orderlies and the transit workers and the firefighters, the grocery workers who are going to work every single day and who are saying, we are really going to help fight this disease, and this is our job, and this is the soul. It is the kind of the kindness, the compassion, that I see in big and small ways all across America. It's the sense of the Army that could put Javits to make Javits as a hospital in 3 days, and looking at that kind of work and what it means in terms of America. It's the gratitude I have every time I see someone calling someone else to say, how are you? And what can I do for you? It's the giving a delivery man or person who is delivering pizza to your house a tip that is double or triple what you would ever have done before. And seeing that. It is all these artists who are home playing great music and sharing it with all of us. It's, you know, Stephen Colbert or Kimmel, you know, sharing their jokes with all of us. It's the it's this kind of big and small heart of America that even in this physical distance, people are doing things to connect with each other. The last thing I will say is this: let us all be the people we want others to be. Let's all find the hope in the darkness and not to despair. And in terms of us as Jewish people, we have been through crisis before. We have been through plagues before. We have been through much, big and small. But we have always found a way to have gratitude for each other and to find the hope down the road, whether it is crossing the Nile, or whether it was 40 years in the desert, or whether it was after the horror of the Holocaust. We have always found that the righteous path of justice and gratitude was a way for us to move forward. And that is what I see and feel every single day with our members. And I am grateful on this few days before Passover to have this moment to be with all of you.
Well, this is Ron Klein, and again, want to thank both of you for your inspiration. Randy and Anne, both of your ending comments were just perfect. It really, I think, probably the most inspirational thing for me and many people who've listened to these Democrats Leading in Crisis series is the last question that Haley answers, and that is, with all the difficulties, the challenges, and we've had people speak on national security, we've had people speak on education and workforce like you did today, we've had people speak on elections and election security, we've had people speaking on the stimulus and how it's going to impact the economy. Every one of these conversations is challenging and difficult and hard medicine to take. But the last question, and the way the two of you just answered it, is what really inspires us as Jews, historically, as you said, Randy, correctly, and as Democrats, and why we love our country, and why we're so inspired to do things in a way which will make things better, which of course takes us forward through this crisis, and then we have an election in the fall, and we're all over time going to have to start focusing very extensively and hard on that. But I just want to thank all of our listeners today for participating in our fourth call on Democrats Leading in Crisis. Your insights and all of you who've been asking good questions, it's very much a part of why this dialogue is essential and why this dialogue is so impactful. Our next call is going to be on Tuesday, April 7th. That's next Tuesday. We're doing them every Tuesday and Thursday. Next week, there'll be an exception. Thursday's a holiday, but Tuesday, we will do it at 3 p.m. Eastern Time. We're going to focus that one on a progressive Passover, and it's going to feature our Next Generation Leadership Council, rabbis, and some other activities. So we look forward to it, think it'll be really inspiring, and look forward to you participating. We also just want to say once again, please visit jewishdems.org, our website, to support JDCA, to support us in joining with us, being part of our activities on our college campuses when they reconvene, being part of us in our state chapters where the electoral college will matter, or whether there are Senate and House seats, that we're going to do whatever we can to make sure that a Democrat wins. And of course, this is the most important election of our lifetime, and we appreciate your supporting JDCA both financially and otherwise. So we hope to see you and talk to you again on Tuesday. Stay healthy and safe until then, and with that, we're signing off. Thank you.